Well, good afternoon, folks. I'm about probably 30 seconds or so ahead of the game, but at the end of the day, if we can get time back in our calendar, I think that's a good thing, right? So I'm just going to do a really quick introduction, and then we're going to turn it over to Mike Chapman, our subject matter expert in all things healthcare. Mike has been a very generous donator as well as a great contributor to the Southlake Focus Group for a number of years as it relates to our healthcare options. He provides no cost, no obligation consultations for those in career transition for healthcare. And as we all know, in the year of 2020, healthcare is kind of a big deal, right? And so at the end of the day, we're very pleased to have Mike with us. He literally has helped thousands and thousands of businesses and individuals around Texas over the years and giving them the best choices as relates to their specific situation. So without further ado, I'm going to introduce Mike Chapman. He's going to give us about 45 or 50 minutes of really good information. So all I can tell you is you need to listen fast because there's going to be a lot of information he's going to share, and he's going to have a brief Q&A session at the end as well. So Mr. Chapman, welcome. We're very happy to have you here today, and the floor is yours.
All right, thank you very much. I'm going to share my screen. Give me 1 second here. How about a sound check? Can everybody hear me? Hold on 1 second. All right, I'm going to make sure you can hear me. Can I get a sound check? Can everybody hear me?
Yes, we're good.
Yeah, we can.
Okay, good deal. All right. Hey, thanks for being here. I know it's a beautiful sunny day in spite of all the crazy stuff going on in the world. I know your time is valuable. I'm going to suggest you listen to this. Take just brief notes because I'm recording this as we speak, and we'll post this to YouTube and share the link with Ed. Okay, so there's a lot to cover, more than any sane person would ever, unless you're transcribe or something. There's no way you keep up with this. But the important thing is that you just go through the basic presentation, and then I can help you individually. So keep any comments at the end to the actual, generalities, but not your specific situation, okay? And I'm going to minimize that, get that out of my way. And you can see the slide deck, right?
Yes, we need to see the PowerPoint version as opposed to the whole screen, though.
Yeah, so that's what I am working on. The current slide is not letting me, oh, I know why, it's a PDF. Hold on 1 second. Sorry, folks. There, now we can see it in just a second.
Okay, I see it loading up there.
Yeah, and that's a PDF, so I'm going to close that. And I'm going to move this. Well, hell's bells.
Yeah, go ahead and close your share and reshare.
Okay. Stop share. Go to presentation. Take a deep breath, Mike. Okay, there we go. From current slide. Now back to share. Sorry, folks. This isn't my first Zoom session, but you'd never know it, right? Okay. There we go. All right, we're here.
There we go.
All right. All right. Somehow we made it through 8 months of pandemic, 11 months of the year. What a year of chaos. But this is a presentation about hope. Okay, this is a presentation about what you can do to reduce risk, your cost, and things you can do now and what you need to be doing in the next 3 weeks. Can you hear me okay still?
Yes.
Okay, all right. You know, this has been a crazy year. Fortunately, we're only a few months from putting it in the rearview mirror. So above all, always keep hope and have faith. A little bit about me. I've been doing this since 9/11, really. That's when I jumped off the corporate bandwagon and became self-employed and decided, hey, I'm going to start into this medical business, medical insurance business, because I had people with pre-existing conditions and travel all around the country, and it drove me crazy, and I was responsible for it. So I raised 2 kids because I couldn't live out of DFW anymore, and I raised 2 kids as a medical insurance broker, and I've stuck with it, and I've never looked back. It brings me a lot of personal joy to know so many people and to have helped thousands of people across Texas, and especially in the Metroplex. This starts with a 5-minute phone call, but I'm going to make some because we're in the final stages of open enrollment. I'm going to ask you to help me, and that is to don't send an email, but to call me or leave a text, and I can return your call in the evening. Literally, I'm getting about 60 calls a day, and up until last week, I was answering every one of them on the second ring. And what happened is I wasn't spending any time actually giving people what they needed. So I'm behind a little bit, so I will return calls in the evenings, and I will return texts sooner than that. But right now, I need to produce what my clients are looking for and to give you the information that you need. Also, you know, the old adage, free advice is worth what you pay for it, but I'm a commission-only broker. You pay the same amount, just like you would a real estate agent or buying your car insurance if you buy your car insurance from an online or a local agent. But what I do is I have the expertise and provide the support throughout the year. I give a number of talks every year. This has been no exception. This has been a very unusual year. And because of what's going on, a lot of the rules and regulations change, by the week, and that's going to continue as a result of the administration change. There will
Hey,
be
Mike, could you get a little closer to the mic? You're kind of fading in and out.
All right, sorry about that. Can you hear me a little better? I'm going to speak up also.
Yes, okay. That's better.
You're going to continue to see a lot of changes throughout the year. Every year I put in about 500 hours in August through October, certifying with all the insurance carriers in North Texas, plus about another $500 of non-insurance healthcare and benefits research. So I can literally talk to people about any option that's out there, and I'm appointed to all these carriers. I don't play favorites. I'm going to find the best solution for anyone, and I guarantee you that very few agents or brokers would ever invest this amount of time or put this amount of personal, emotional effort into this. Come late October, I'm ready to help individuals that are over and under 65, plus my employer clients. And I am now in the final weeks of open enrollment, which means it is a full-out caffeinated Red Bull experience. And this is my once-a-year climb up, personal Mount Everest. Because there's so many people that depend on me for information, existing clients and new clients. A little bit of overview of the pandemic this year. 27 million Americans are without health insurance that they have traditionally received from an employer, and for the first time are out there looking for an insurance on their own. And it is, as you may know, it's a deer in the headlights experience, because for the first time for many, it's the first time they've ever had the shot for their own plan. They just pick from between Plan A and Plan B for an employer. The workplace has changed. This remote work and Zoom life is probably not going to go away. As much as I would like to meet with people, that's a fact. Business travel has lagged and will continue to lag. And as a result of unemployment, the people that take longer to get rehired are the people that have a little bit of gray hair like me. You know what I mean? There's also a tremendous mental and emotional impact of being cooped up. But what you're going to find as we get out of the pandemic, hopefully over the next few months, is that there's going to be a return to rules and regulations that were waived as a result of the public emergency. Also, telehealth and retail primary care. And I don't know if you read, but Amazon actually finally introduced their online pharmacy as of 2 days ago. So there's going to continue to be a lot of changes in healthcare. Now, you have things to look forward to. You have the Moderna and Pfizer vaccinations that will be available possibly by the end of the year for high-risk people. And you're going to have a new administration with new views and a healthcare agenda based on their view of the world. So there's going to be a ton of changes in 2021. But I put this together earlier this morning, and we're so close. Please be careful. We lost 620,000 Americans during the Civil War, 291,000 during World War II, half of that amount, less than half of that amount, World War I. But year to date, in 8 months, we've lost 250,000 people to COVID in this country. And here it is, we're only the 18th or 19th of the month of this month. So we could easily surpass, unfortunately, World War II numbers by the time the vaccines are ready. So please be careful. We're that close. Again, this is the first time that many of you may have purchased insurance. I'm going to go through some basic stuff with you. First of all, insurance is not health care. Insurance is a mechanism for spreading and sharing the risk of medical expenses. There's two types. Okay, you have public insurance, employment insurance. I guess there's three, and individual insurance, which is separated by 65, under 65, and over 65. This is the most regulated and crazy industry in the country. Each state and each zip code can have different rules and different options. And there's more risk, obviously, when you're purchasing insurance for yourself than there is if you're part of the federal government, an employee of the federal government, FEHB, or if you're an employee of a 20,000 life employer. There's more risk, so therefore it's going to be more costly. Individual insurance premiums, if you're out shopping for yourself, may be subsidized by Uncle Sam based on your age, your income, and your household size. Now, oops, going the wrong way. You have, these are the types of insurance coverage for pre-existing conditions. You have government insurance. Again, Medicare, Medicaid, TRICARE for veterans, FEHB. You have employer-based health insurance, COBRA, 18 months if you work for a company that was over 20 lives. And then Planse through the Affordable Care Act is how Texans can get coverage for pre-existing conditions. People always ask, well, I thought that went away. Well, yeah, it went away for under these guidelines, and there is an open enrollment period, because if without an open enrollment period, people would sign up. You know, it's like buying insurance on your house once the house is on fire. It doesn't work that way. You have to have a period of time when you can enroll, and then you can disenroll, unless you have a special enrollment period, which is death, divorce, remarriage, loss of a job, etc. There's about 23 of these special enrollment periods that you may be able to enroll outside of an open enrollment period. Medicare ends December 7th, and plans for people under 65 and December 15th. Okay, now factors that impact individuals' insurance decisions. Pre-existing conditions. Okay, and again, it's not people always ask, what is a pre-existing condition? Well, if you've ever picked up a prescription, or if you've ever been diagnosed or treated for something, it's in your medical records and it's considered a pre-existing condition. That impacts your decision, your age, your income now because of the rules and regulations of the Affordable Care Act, your job time horizon. If you plan to be employed and eligible for an employer's plan in 30 days, that's a whole lot different time horizon than, say, if you're not sure when you're going to be eligible for an employer's plan. And then the other thing is, are you going to be a part of the gig economy? Or are you going to be an employee? A gig economy, especially for people in their 50s and 60s, may provide income sooner than a W-2 job opportunity. And with that means you're going to have to shop for individual insurance, most likely, as a 1099 employee. And then Medicare, how soon till you're eligible for Medicare. Now, the plans through the Affordable Care Act are based on your household size and also this thing called MAGI. That's a modified adjusted gross income with any tax-exempt interest income and certain deductions added back in. And let me tell you, this can cause a grown CPA to cry trying to figure this out. You can also deduct your individual or your traditional IRA contributions if you have a retirement plan, but you also have to include your children's income if you're declaring them as dependent. Now, this is a real important slide that I haven't really gone through in the past. How much you actually pay for insurance through the Affordable Care Act is based on your household income, and it's based on your size. I have some lines in here I want to explain. If your income in Texas is, let's say, I'm going to keep it simple, for a household of one, is less than $12,760, you're not eligible for a premium tax credit. Why? Because in Texas, we did not expand Medicaid. So there is you can still get coverage, but you're going to find without a premium tax credit that plans through the Affordable Care Act are not as good and are more expensive by a factor from, as best I can tell, usually on average about 40% more expensive than a COBRA plan or an employer plan. And then at the other end, if you're making more than 400% of the federal poverty guidelines, then you're also not eligible for premium tax credit. Now, what's this line? This is the line where you're at up to 150% of the federal poverty level, where you're eligible for cost sharing in addition to the premium tax credit. That is where you may be, your out-of-pocket expenses will be subsidized as well. So your co-pays and deductibles and co-insurance and all that kind of stuff will be bought down as well. So that's an important number here. Hopefully you've noted the numbers based on your own household size. In Texas, there are, and this is 2020, estimated there are 65% of the people that are on the exchange, in other words, through healthcare.gov, are eligible for cost sharing or a premium tax credit. There's another 11% that are eligible for just the tax credit. And then there's this portion here that aren't eligible for financial assistance at all. Now, why would they purchase a plan through the Affordable Care Act if they're not eligible for a tax credit? Even though it's expensive, it's because they have a pre-existing condition that's significant, chronic, expensive, or potentially life-threatening. But the first strategy you need to apply is consider unbundling your health insurance. Analyze the options for each individual member of your family. Let's assume that, and this is the Ozzie and Harriet traditional family of four. Let's assume one family member, we'll just say your daughter, has a significant life-threatening pre-existing condition. Everybody else is relatively healthy, but let's say you or me in this case, has seasonal allergies and maybe takes a generic medicine you can get at Walmart for $10 or something like that. Well, this person needs to stay on healthcare.gov if that's the only option, or COBRA, until you can get onto an employer plan that covers all pre-existing conditions. But everybody else, there may be better options at a lower cost depending upon your income. And even you, if you don't have significant, expensive, or life-threatening pre-existing conditions, then okay, if you're spending 10 or 20 bucks a month in medications, but you can find something else that covers everything but those not life-threatening or expensive conditions for less expense, that it's going to it's financially, it may make sense for you to do it based on a comparison between what your option is if you're eligible for a premium tax credit. Okay, back to the tax credits. Here's what counts as a modified adjusted gross income. Income from W-2 or 1099, rental income, dividends. I'm going to talk about this separately, okay? Withdrawals from retirement accounts, Social Security income, unemployment income, any temporary assistance through additional unemployment, and any additional stimulus funds next year that may come about are taxable. It's taxable income. You've got to estimate this. Now this is important. If you are a spouse, have access to a group health plan, in other words, you may need coverage, but let's say it's really crazy expensive to be on your spouse's health insurance plan, but that's still an option, then you are not eligible for premium tax credit. Okay, so a plan through the Affordable Care Act, you have to compare with what the cost would be to be on your spouse's plan, but there's no tax credit. And then also, if you haven't paid your taxes or resolved your tax credits from the previous year, you're also not eligible for premium tax credit. And in Texas, because we didn't expand Medicaid, if your household income is too low or too high, then you're not eligible for tax credit. Now, this cost sharing only comes, which I talked about previous, if your income, household adjusted gross income, is less than 150% to 100%, you're eligible for cost sharing, but only if you select the silver plan. Now, cost sharing reduces your copays and deductibles and out-of-pocket expenses if you enroll in a silver plan. But I'm going to show you something, and that is modified adjusted gross income below 138% of the federal poverty level, children under age 19, and the mother may be covered under Medicaid. Also, pregnant women are always covered under Medicaid. They're not eligible for a plan through the Affordable Care Act. So these are some of the little gotchas that you have to be aware of. Now, Medicaid, CHIP for children or Medicaid for adults, it's very cost effective, but there are some, it may or may not be as good as a plan through the Affordable Care Act. I'm going to share a different screen here, and so I can show you. So pardon me for a second while I find a different share so I can show you what I'm talking about. Okay, let's see. We're going to go to here. All right, now I'm going to come down here. Here's an example. Here's income limit example. Okay, here's example, a generic example. Yeah, because I'm using a lot of resources, it'll take a second to bring up. Here's why I have access to some tools where I can very easily help you determine what the income level is based on income. this is 507. At 5071, you're not eligible for a tax credit because you're too low. Your income is too low. And again, this is family one. At 507, $50,071, you're eligible for a $492 tax credit as an individual. But at $50,072, you're not eligible for a tax credit. And, you know, trying to figure out those options through healthcare.gov will take you hours. And it can take me, you know, as much time to get your information. I'll show you how you can help me with that in a second here. But I can do this much faster. I'm going to go back to another option here. And I'm not going to, and this is, you know, I can't tell you how many people I talk to these days who are grandparents' age like myself, but are legal guardians for children. All right. I'm going to go to leads. And here's an example of a mother and child. Now, here's somebody, I'm, you know, a female age 55 and a female 16. They're not going to be able to apply right away for a plan through the Affordable Care Act. Why? Because the adult guardian is a female. It wouldn't happen if it was a male. That's just the way this is set up. But the income is too low for both of them to have a plan through the Affordable Care Act. They may want Medicaid. It may, you know, from a cost standpoint, but they may not like the providers that are in Medicaid. So if I change the income to, that was $1, but let's try $23, 23,000. All right, at 23,000, the mother can get a plan through the Affordable Care Act and is eligible for cost sharing, right? And has a premium tax credit of $681, but the child, there still is not enough income estimate for the child to be eligible for coverage. So she can go on to Medicaid, which can be good or bad. But at 25,000, and you know, I can fine tune this, but I don't want to take too much time. But at 25,000, let's see. I'll just put in 30. Anyways, I don't want to keep going through the estimations because my computer's slow because of the amount of resources I'm using. But you get the idea, right? So let me go to a new share. All right, we're back on presentation mode. Premium tax credits and cost sharing limits. Don't stress out about this. These vary by size, household size, by the age. You could spend hours, days, and weeks estimating income and premium tax and cost sharing and never be any more accurate because who knows what's going to occur in 2021. So don't stress. Just remember, an estimate is an estimate. You pay what you earn in 21. What you show is your total income that you report to Uncle Sam at the end of 2021. The estimate is what provides you the tax credit for the months that you're on the plan. There's no penalty. There's no interest charge. It's like an interest-free loan. You just may have to pay some of it back when you pay your taxes in April of 2022. Now I'm going to go through what's new. That was an overview of the tax credit. Now here's what's new. There's a lot happening in the marketplace in Dallas-Fort Worth. There's expanded networks, and doctors and hospitals are starting to realize that they, especially with employers, shedding people, they need to be in this market. So more doctors and hospitals are contracting with plans through the Affordable Care Act. A company called Better, which is a company owned by the largest insurance company in the country that you haven't heard of. It's actually the largest in the country by the name of Centene. Through a roll-up strategy, they now insure 1 out of 5 people in the country, more than United Healthcare or Blue Cross. They're coming to Denton and Tarrant County. A company out of Colorado called Friday Health Plans is going to be in Dallas, Collin, and Tarrant County. Baylor, Scott and White, which were in the market a few years ago and really own the Central Texas market, are coming back to Dallas and Collin and Tarrant County, and that's part of the Baylor system. You may have read yesterday where Baylor Medical is opening up a med school and research tier 1 research center at Baylor University in Temple. So they're going to be a factor in the market. There's also return of HSA eligible health plans to the marketplace for the first time in 3 years. All of the plans have a telemedicine and telemental health benefit, and all of the plans will offer more doctor visits with copays on many of the plans. There's also confusion. Blue Cross Blue Shield will now have 3 different markets or 3 different networks, and if you're buying on price, you're liable to end up with the wrong network. There's expanded use of generic formularies that I see in all of the plans that are available. There's also an HMO and an EPO network. That's all there is. There are no PPO networks available. Okay, so just don't even think about that. If you lived in Oklahoma, that's what you could find, but here in Texas, that's only HMO or EPO. The only difference between the two, neither will give you coverage out of network, so making sure your key doctors are in network is important, but the only difference between an EPO and an HMO network is with an HMO network, you have to get a referral from an in-network primary care physician to see an in-network specialist. With an EPO plan, again, there's no coverage out of network, but you can pick up the phone and make an appointment with an in-network specialist. And there's higher deductibles next year. Here's what Fridays is offering in Dallas, Collin, and Tarrant. Unlimited primary care visits, annual wellness, health, mental health visits, telemedicine, preferred generic, and urgent care visits. Blue Cross Blue Shield, as I mentioned, has 3 different networks. This My Blue Health network is it's a strategy to offer, and this is not for people that are out, it's only for Dallas County in our area. It provides a lower premium in return for basically having all of your health care decided upon by an urgent care center situation with a joint venture with a company called Sanitas. I wouldn't recommend it if you have medical problems. They're also offering more plans. Higher deductibles. The deductible this year, and this is Blue Cross, but it goes for all the different companies. You're going from $81.50 to $85.50 for individuals, and family coverage as high as $71. Higher deductibles. What can you do about that? One thing you can do is insure your insurance, and it's what I like to refer to it at, and that is, again, there's some additional cost that's fairly affordable, but you can get a small accident plan, a great recommendation if you have children that are driver's age. I remember my 2 sons, when they hit 15 and were driving, boy, it was disposable car wreck time constantly, and I always worried. So having a plan through the Affordable Care Act, really for anybody, you ought to consider getting some accident coverage. You can also get some guaranteed issue critical illness coverage that will protect you against heart attack, cancer, stroke, hospital and outpatient surgery insurance. But again, it's additional cost. You have to determine whether it's worth it to reduce your risk. Now, if you have college students, student health plans are usually the best option for out-of-area college students or in-state college students, both from a premium expense and a quality of coverage standpoint. The student health plans that are available in most of the major state universities in Texas, they are they're far better than what you can find through the Affordable Care Act. Now, here's another option. So I've gone through the options that will cover any and all pre-existing conditions. Short-term health insurance plans. If you're under age 64, these may be less expensive than COBRA or an Affordable Care Act plan if you don't qualify for premium tax credit, but they will exclude and deny coverage for pre-existing conditions. They also don't offer quote-unquote free wellness exams, and you always want to end coverage at the end of the year, because in the event you have an accident or illness, well, yeah, you're covered until that term expires, and if it expires in the end of the year, you're out of luck until the following open enrollment period when you can enroll for coverage beginning the first of the year. And the other advantage is it's really easy to apply. So it's a way of covering yourself for a number of days until you're eligible for an employer plan until the end of the year. Now, I was actually on a Christian healthcare sharing ministry program myself for about 4.5 years. I've been self-employed for 21 years, and it's a great option if you don't have serious, potentially life-threatening, or serious pre-existing conditions. They will cover anybody who is age 65, who is Christian or lives a Christian lifestyle. It's very affordable, especially for families in age 55 and up. If you're healthy, you can get a 20% discount. If you're not so healthy, you may pay $100 more per month, but it's still going to be maybe a third to as much as 50% less than the cost of COBRA or a plan through the Affordable Care Act. Again, won't cover pre-existing conditions for a few years, but you won't be denied coverage. The other thing about this is, unlike the plans through the Affordable Care Act, some of the plans will offer you access to a PPO network, although most do not. And some of them are very well run and work like clockwork. I wish insurance companies worked that well, but many of them do not. And I can send you more information on request. Another option for you, if you own a business and have one full-time employee, or your spouse has a different last name, you can set up a group health plan. In Texas, it's by law. If you have less than 50 employees, you can set up a small group health insurance plan. It requires you to be a legitimate business. You have to make a payroll and pay payroll taxes, and then report to Texas Wage and Tax Commission quarterly your income and pay employment taxes. But it's one way that you can get coverage and have access to a very good PPO network of doctors and hospitals. You have more wide choice of types of plans, both PPO and HMO. And the end result is, if you don't qualify for premium tax credit, a small group health plan, I did this for a client last month, it can cost 40% less than the cost of a plan through the Affordable Care Act if you and your employees are not eligible for premium tax credit. So again, this is an option in certain situations. Now, Medicaid. I mentioned Medicaid with the example. Who's eligible for Medicaid? In Texas, it's children under age 19 based on household income, pregnant mothers based on household income, and then adults age 65 based on household income and assets, and then guardians or parents of a child under age 19 if the income is low enough, and that's women. Okay, so if you are a woman and have a child under age 19 and your income is low enough, you may be required to enroll in Medicaid. You have to requalify every 6 months, and then also the state can claw back the benefits received in the event you have an increase in household income or assets. And if you die, the state will claw back the money spent on Medicaid from your estate if you die. And you can find out more information. This is a key website if you fall into those situations. YourTexasBenefits.com or TexasChildren'sHealthPlan.org are where you can get more information. I help people. I help refer people to Medicaid. It's a great program, especially for children. But it's not something agents and brokers like myself can can actually help enroll you. Who's eligible? Here's an income chart. Okay, children under age 19, pregnant mothers, and adult guardians. All right, and adults age 65 plus. Adults age 65 plus. Remember that clawback. Now Medicaid for adults, and I'll just use the as an individual option here. If your income estimate is $16,971 or monthly $1,415, which you could well be if you're unemployed, right? And your only source of income is maybe unemployment, you may be eligible for Medicaid. If you have children under age 19 or you're over 65 or you're the woman and legal guardian of a child under the age of 19. If you have children, regardless of the number of children, okay, here's how the income works out: $25,000 on the basis of that. But look at the cost here. Let's take a family. Let's take a single parent with 3 children. It's only going to cost $50 per year to cover 3 children. It's a great option, and the idea is to keep children healthy when they're developing. So CHIP is a great option. Was it going to have all your doctors? No, but it's hard to beat $50, and it certainly beats not having coverage. Let's talk about Medicare. I'm probably about half of my business today is with people that are over age 65, and if you're approaching that age or are that age, I'm going to give you a brief run through. This is not meant to be a Medicare presentation, but I always get questions from people who are wondering how that works, and maybe you're 63 or 61 or 64 and starting to get pounded by junk mail and advertisements. First of all, you have to be age 65 or on Social Security disability income. It says 2 months. It's actually for 24 months. You apply for Part A, and Part A I'll talk about in a second. Part A is what your payroll taxes have been paying for. 3 months before your 65th birthday, you always, no matter what, want to sign up for Part A. For Part B and also Part D, you can apply 3 months before your 65th birthday, or 2 months before your birthday month, or 3 months after your birthday month. Or if you're terminating from an employer at age 65, just like COBRA, you want to apply for Part B within 2 months of termination. And then once you get your Medicare card that has Part A and Part B on it, that's when you look at Medicare Advantage or Medicare Supplement options. And I'm happy to help anybody that's in that age who has questions. Now, right now, today, as we sit, compared to other options for people that are age 65, Medicare is a super deal. It could well change in the future. One, the baby boomers, my generation, there's like 10,000 people a day retiring who become Medicare eligible. And so the numbers are going up, and people are living longer than we ever expected, at least until this year. But for under $300 a month, you could have unlimited access to any doctor or hospital anywhere in the U.S., and your only out-of-pocket medical expense for the year for 2021 will be $203, plus your co-pays for and out-of-pocket expenses for your medications. And that includes Part A. You're going to pay $148 for Part B. Part A is free, okay, if you've worked 10 years. Part B is going to be $148.50. A Medicare supplement and Part D plan, you can budget on about $300 a month. And your only out-of-pocket medical expense risk will be $203. Or you can spend $148.50 a month, which is the cost of Part B for 2021. And you can have a network of doctors and hospitals, but you will have an in-calendar out-of-pocket medical expense risk between $3,400 to $12,000 per year, plus your co-pays and out-of-pocket expenses for your medications. And this is called a Medicare Advantage plan with Part D prescription drug benefits. So that's an overview. $300 for basically $200 worth of risk per year, $149 with more risk. Why would you want to spend more? Because once you have a Medicare supplement, you can stay on that forever. With a Medicare Advantage plan, you may be perfectly healthy now, but that can change in a second. I know personally how quickly that can change. I see this all the time where people turn 65 and they sign up for Medicare Advantage because they're lured by the TV ads, how much, maybe they get some cheap free dental insurance or something like that. But what happens is one spouse or the other gets chronically ill and their life savings are drained, and because they're spending $3,400 to $12,000 a year in out-of-pocket expenses. There's also in Medicare what's called IRMA, and this is a wealth tax. It impacts individuals whose 2-year average income is more than $85,000 or couples $170,000. And it goes up from there. And IRMA can double or triple the cost of Medicare. And withdrawals from retirement funds, bonuses, sales of real estate, that can cause you to be assessed IRMA tax penalties and really raise the cost of your Medicare. So income timing, when you declare income or can time income for some of these things, can have a big impact on what you pay for Medicare. And you only have one opportunity to enroll in a Medicare supplement plan without answering health questions. And that's when you first enroll in Part B. You have 3 months before, your birthday month, 3 months afterward. If you miss that window, you can still enroll in a Medicare supplement plan, but you'll have to answer medical questions. One more fact on Medicare, and then I'll shut up about Medicare. So I just had this happen last month. A client and her husband comes to me. He has major health conditions, has been on Careerr for 6 months, not knowing that Careerr is not creditable coverage, and their insurance plan, they didn't understand that because they didn't sign up for Part B, that Careerr would cover their medical costs. You must enroll in Medicare within 6 months of termination, or you're going to be subject, not only will you be responsible for any medical expenses, you'll also be subject to a late enrollment period, so you won't be able to sign up for Part B until the following July, and you'll be assessed late enrollment premium penalties. So whatever, if you're age 65, sign up for Medicare, don't sign up for Careerr, and don't count on your Careerr administrator or your HR department once you leave to go through this with you. Also, if you decide to go back to employer-based coverage, you can drop everything but Part A. Okay, and our Part A, again, there's no cost if you have worked for 10 years. Again, Careerr is incredible at age 65. I'm not going to talk about Social Security, so I've gone through the gamut here. Careerr, ACA or Obamacare, CHIP, Medicaid, short-term health insurance, Christian sharing programs, small group health plans, Medicare, student health plans. There's a lot of options. Now you can spend days, months, weeks frustrating yourself and wasting your time, or worse yet, you can go online for some of these online web services that are basically lead services that sell your information to literally hundreds of agents who will robo-dial you to death. Don't go online for that. You can also sign your Careerr election form for everybody in the family and just write a big check to Careerr every month and go back to work and don't worry about it. You can also sign everyone up for one of the previous plans. You could sign everybody up for a plan through the Affordable Care Act or a short-term health plan or anything else. Or worse yet, you can get bored or distracted or overanalyzed and you end up missing your enrollment deadline, or you sign up for it at the last moment. And then you end up making a bad decision, or worse yet, you don't make a decision and you missed your window for open enrollment. So here's again the considerations: who's healthy, who's not, household income, age, your job search length. The longer the length for a job search, or if you're going self-employed like me, that comes with more risk. If you're likely to get a job or land a job in the next few months, it's less risk. How much you want to budget, and then your availability of available liquidity and assets. And then, do you really want to drain your retirement plans and funds now while you're in a job search mode? You may have to, but there may be other options for you. Now, here's something that's really important, and this goes with anything in life, and that is to make a decision now and then implement it when you need to. It greatly reduces stress and peace of mind. There may be a government subsidy in January with the new administration after January 20th. Who knows? Then reconsider it. But at least have a battle plan, an action plan that you can have a discussion with your spouse and you can plan and budget accordingly as a team and, review some of this stuff. Goodness knows, job search is stressful enough. Going through a job search, whether it's you or your spouse or both of you are in job search mode, that is really stressful. Now, and focusing in on that is important, is number one, but then trying to figure out this healthcare stuff, at least go through this, and this will be posted on YouTube. I'll send the presentation to Ted so that you can, talk about it with your spouse, because I've seen a lot of marriages fail, and know personally of some marriages that have failed during a job search because of the stress that puts on a family, and that's unnecessary. I can get the information to do the homework on all the available options for each family member, get you proposals to evaluate, and save you from making a bad decision or no decision. Because you may not like the decisions that are available because maybe they're not as good as you had as an employee. Or your spouse may want to insist that she sees a particular doctor that's not in any of the networks. But nothing's good except by comparisons. I can present and make recommendations, but the worst thing you can be doing is searching for the golden unicorn. There are a lot of bad agents out there. They're unethical, that will promise you the moon and say, yeah, it's covered, blah, 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 and it turns out not. I've just presented to you all your options, a stress-free way to help determine which of your doctors are in or out of network and go through this. And, 5 minutes are all this takes. But right now, my time, because I'm less than 3 months, or 3 weeks rather, I wish I had 3 more months to go through this. But right now, phone calls, I can only return phone calls in the evening. Last week, through Friday, I did nothing but answer phone calls on the first ring. And I'm still catching up with people. And I'm still following up with those people, okay, because I didn't do my job during the day. So I'm going to be returning calls in the evenings. I can return a text faster, but and emails, it may be a day or longer before I can return an email. That's just the way it's got to be for the next 18 days or something like that. And again,
Mike, we've got just a couple of questions. So if you got to a good pause point, I'd like to have those presented to you. Is that okay?
Yeah, let me go to, I want to bring up one thing here, and that is right here. You can see it in the line here. You can go to this link and enter your information and view Medicare plans, or go to this link and enter your information to view Affordable Care Act plans. And then I'll be able to look at the information you input, and when I call you back, I'll be able to say, I think you should do this or that, and help you through the unbundling question. So let's go ahead with questions.
All right. Thank you, Mike. So our first question comes in from, let me move back up here to the top, comes in from Polly. If you choose a Medicare Advantage plan and you don't really like it, can you really change back or easily change back to traditional Medicare coverage?
Yes, there's a time period that you can do that. There's one time you can do that. Okay, when you first go onto a Medicare Advantage plan, you have a period of time when in the first 6 months you can go back to original A and B Medicare and then select the Medicare supplement. But after that, that's it. There's also a period where if you don't like your Medicare Advantage plan, there's a open enrollment period to change your Medicare Advantage plan in January, but you won't be able to change back to a Medicare supplement plan if it's been more than 6 months.
Thank you, Mike. So just for everybody's insight, if you have a question, just go to the bottom of your screen, move your cursor down there. You'll see the little chat box. Go ahead and put your chat in there, and we'll get Mike to answer the question for us.
Okay.
Next question from Raj. I'm unemployed. My wife is a contractor. Her contract ends December 31st. If neither of us finds employment by then, can we contact you after the December 31st for options?
Well, there's an open enrollment period. Okay, if you're a contractor now, and it does not come with a group health insurance plan, then you have to enroll between now and December 15th if you're under age 65. If you have a group plan as a contractor, and some staffing agencies, especially if you're an IT person, you may be eligible for a group health plan. If you're on that, then that has a group health plan. So, and you'd be eligible for COBRA, and also that would be considered a special enrollment period situation. But there are all types of insurance as 1099 contractors. So it really depends, Raj, the type of insurance that you have from your company. I'll be happy to to get more information. I would say that if I hate to say it depends, but it is not. You may miss out on some opportunities if it's some staffing agencies will offer to contractors, quite frankly, some pretty crappy insurance. So it really depends. And by the way, thank you, Alan Crowley. That link should be joe.my, not MA. So try joe.my/quotes. Let me know if that works for you. I tried it right before the presentation, but couldn't change the tagline.
Thank you.
So we've got just about time for one more question. And so there it is, I am presently on COBRA. I plan to terminate it after December and go through open enrollment for ACA coverage. That's for me and my wife. I guess the question is that good or bad?
Well, if COBRA ends, in other words, if you've gone through your 18 months, then that is a special enrollment period. But if you are voluntarily ending COBRA, then you have to do it now and enroll for, have voluntarily drop COBRA effective the end of the year and enroll between now and December 15th. I know a lot of employers may subsidize COBRA for, say, 4 months or 5 months, after which you're paying a lot of money. But the only special enrollment period is when you go through all 18 months of COBRA. Otherwise, you have to enroll in an ACA plan during open enrollment, which ends the 15th of December.
All right, so that's going to bring us to a quick wrap up for this session. I hope it was insightful for you. I wrote lots of things down, even though he said not to write things down. I did. And so as Mike mentioned, once he sends me the talk, that will be posted up on our Southlake Focus Group private Google Drive. And you'll look for that the next couple of days. It will be there for you. So Mike, I just wanted to give you a big shout out and thank you for your time and expertise. As everyone probably heard, there are enough acronyms in this talk to make you glaze over very quickly. But yeah, that's just the nature of the beast. And so if you can find somebody who kind of understands it, can help you walk through that, that's always a good thing. So I just wanted to say thank you for all those folks who were with us this morning, either online or in person. You stayed in there through networking, you stayed in there through either Jumpstart, and now you came back in the afternoon. Thank you so much for that. We really appreciate it. Go out there and have a wonderful week. Have a blessed, safe, and prosperous Thanksgiving. So our online session for Mr. Mike Chapman and how you can help yourself reduce your risk is now officially over. Go out and have a turkey leg on me.
All right. Thanks, everybody.
Mike, I'll hang on for just a couple of
All
seconds.
right. And I'm going to stay on here. I'm going to pause. I'm recording this. I'm going to pause and then finish the rest. And that'll work. First of all, let me make a correction. The link you want to go to for reviewing or for inputting your information or reviewing plans is joe.mymedicare, joe.my/Medicare, or joe.my/quotes to review information for people under age 65. I can help you with unbundling strategies, plans through the Affordable Care Act, Medicare, CHIP. I can answer questions about CHIP, and I can help you with Christian healthcare sharing ministry programs or short plans. And I'll send you information, but this time of year it's tough to keep up with phone calls, so it's best to text me. I may not get to an email message for a day. I'm not being rude. It's just because of the time of year and coming up on the end of open enrollment. So I will return calls in the evening and be able to respond to text a little bit faster, but emails it may be a day or longer before I can get back. Now, the medicalinsuranceexchange.com has actually been rebuilt, but it's been held up by insurance compliance police. Every single insurance company and Center for Medicare Services has to approve it, and so far they have not been very swift or responsive in the changes. So that hasn't happened, even though open enrollment will probably be over before I get it done. But it is a safe place to do your research rather than going online. It's a safe place to do some research. That's why I say it's really more than an e-commerce store. The original intent of the healthcare.gov site was to be just like Amazon. You could shop for insurance on your own and pick a plan, blah, blah, blah. And we all saw how that happened. What happens when you let government bureaucrats who never had to deal with this stuff and Canadian IT contractors develop a website. The site itself is more stable, but it is very, very difficult to navigate and to understand. And so everything that I discussed today will be on the site, but it'll have more detail with quote engines. Again, this particular, actually that is right, joe.myquotes and joe.mymedicare is correct. You can enter your information there, but put your information and look around, but then call me. Or if you put your information in, then I can look at it before I call you, and you've just saved me about 15 minutes of getting that information over the phone and saved you time too. Then I can provide some detailed recommendations after we talk and get you what is in your best interest. I'm also doing some live streaming in the evenings on Monday from 5 to 6 p.m. through December 8th, the last week of open enrollment. Can't do it. So those are ask me anything type questions. Be happy to go through options. Here again are those links. And in your income estimates, what you made for this year doesn't matter. You may have had income for, 6 months, 9 months, 2 months this year. Doesn't matter. What matters is what your 2020 income estimate is. And again, it's just an estimate. I'm going to need your doctor's names and where their office is located. And please, if you misspell the name of your doctor because it's an unusual name, I can't help you. I'm just going to tell you, hey, that doctor isn't in a network. but also your conditions and your medications. Don't hold back, because you don't want to end up with something that doesn't do what you want it to do. And then I will send to Ted this replay, and send the slide deck, and you can watch the replay on YouTube and take notes, detailed notes. And then, there will be some things that you may not have been able to keep up with. A lot of acronyms. I'll go through that so you can slow it down on YouTube. What I like to do is go onto YouTube and watch things double time. But in some of this stuff, because it's a foreign language, you may want to go to half speed or hit the pause button on it. Now, if you help me, you can help me if you have benefited from this presentation, but you prefer to do it yourself at healthcare.gov. Please do this. When you're enrolling in healthcare.gov, please, and it's at the income estimate portion. When you're asked by healthcare.gov if you have received any help from your insurance, please enter my name, Michael Chapman, and it's called an NPN number, National Producer Number, 775-1382. By doing that, I can help you in the future with insurance issues or problems that come up with healthcare.gov, and I get compensated and continue to support our community and you every year. So please do that. If you, I've had people actually many people have attended a webinar session, said, "Hey, I did just what you told me to do, and thanks so much. You saved me a lot of money. I talked to my broker, and we decided to do that strategy." And I said, "Well, thanks very much." And actually, recently somebody said, "And what's new for this year? Can I take 15 minutes of your time so I can see what else I can do?" And I said, "Well, my time's really valuable, and especially this time of year, but you can help me by doing this." And that not only helps you, but it helps the community. 5-minute phone call is where it starts. After you enter your information or send me a text, I'll return the call in the evening. Be happy once I can send you proposals for you to look over. We can do a joint phone call or Zoom meeting. That's how I want to spend my time during open enrollment to go through this. One more thing, don't underestimate the length of your W-2 job search and the impact of age discrimination on your search. I faced it. I didn't go back to the corporate world before my insurance business and practice really took off until, for 5 years, I thought, well, I could go back to, being a hot shot for a corporation. It didn't happen. I'm happy it didn't happen. It all happens for a reason. But also consider alternate careers, 1099 income stream, and non-corporate opportunities that provide you money, especially if you're age 55 plus. Even if you go back to a W-2 job, start developing a second source of income, because this may not be the last time you're in job search mode. And the more options you have that can keep you from draining your retirement funds, because you have more sources for income, the better. And then consider where you want to spend your time. You want to spend your time trying to learn all these fancy names and figuring out what acronyms are and looking at every option. And trust me, it's taken me almost 20 years to learn this. And doing it yourself is not the best use of your time. In my estimation, the best use of your time is to work on your job search and accelerate your job search, get more 1099 income streams going, because that's going to put food on your table. You can also consider reducing your overhead. That's just an aside, but trying to learn everything possible about insurance is not a good thing. I wouldn't recommend it. You see, you see what I'm doing this time of year. You'll be doing the same if you put a lot of time into this. This pandemic is still going on. So is the recession. There are going to be new stimulus packages and new taxes to pay for the current and new regulations that impact insurance. Changes to the information presented today are inevitable. So connect with me on LinkedIn. I'm one of the top 10 most connected individuals in Dallas-Fort Worth. I'd be happy to help if I'm personally connected with anybody that might be a target might work for a target company, I'll be happy to make an introduction. I have a number of connections where I don't have a personal connection, but if I can help, I'd be more than happy to do that. And one more thing, and please don't forget this. This is so important. As a good friend always said, don't ever give up. Thank you, Denny, for that. I'll always remember that and always remember you. And always, always, always have hope and faith. It's so important, especially in these times. Thank you. It's been a pleasure. I appreciate your time and hope you learned something out of this. And I look forward to talking to you. Have a great day and take care.